Finding out that you have heart disease can often have a major impact on you and your loved ones, both mentally and physically. The psychological adjustments can be very difficult. Finding out what to expect, what is normal, what is not, and what will help at a time like this really provides an easier adjustment to this new diagnosis. There are many common reactions to having heart disease. Especially in the beginning, it is very normal to feel overwhelmed and confused. Some people even behave at times as if it were not true or no big problem, and may sometimes feel shock and denial. It is common for people to respond to being newly diagnosed with heart disease with fear, worry, or a sense of loss of control. It is very normal to experience some anxiety, wondering about what will happen to you and your family, how you will handle having this disease, and how your life might change as a result of this diagnosis. It is also typical to see people responding with feelings of frustration and irritability. You may experience some anger with the situation, self-blame, or even irritation and anger at others. Other people may respond to their heart event with feelings of sadness, upset, and discouragement. It is common to feel a sense of loss around certain areas of your life that have been impacted, such as your health, your level of energy, your ability to do certain activities, your financial situation, or even overall lifestyle. All these reactions are understandable and are normal grief reactions and natural emotional responses to being diagnosed with heart disease. They tend to be relatively brief and become less intense over the first few weeks or even months after your first cardiac event. While troublesome, they most likely pose no serious threat to your recovery. Working towards healthy adjustment to living with heart disease is a critical step in recovery and is accomplished typically through 4 different pathways. Acceptance of heart disease is reached first and foremost through having knowledge and a comprehensive understanding of the disease. It is important that you ask questions and become informed about the specifics of your condition. It is also very important that you have a person to talk with about the thoughts and feelings that may arise about your heart condition. Verbal and emotional processing about being diagnosed with heart disease have been found to be linked with healthy adjustment. Next, it is critical to have a comprehensive and workable rehabilitation plan. Having this plan, along with making progress on this plan, are key factors in reaching a state of acceptance. Now that you understand the steps to take in working towards healthy adjustment, we will turn towards consideration of the psychosocial risk factors that are critical in having a healthy recovery from heart disease. Cardiologists and psychologists have been studying the psychosocial risk factors for heart disease for many years. Their extensive experience and research shows that 4 general areas present a significant risk for the development of and recovery from heart disease. The factors that have been shown to be as critical to address as diet, exercise, smoking, blood pressure are the following. First is prolonged distress. Second is depression. Third is hostility. And the fourth is insufficient support from others. Excessive and prolonged stress, habitual worry, and fear can lead to a wide variety of emotional symptoms. Heart patients who are more emotionally stressed tend to have more heart complications, reoccurrences, and rehospitalizations following their first event. Finding ways to manage your stress level is an important component to your rehab plan. Some natural self-care stress busters include managing your time, engaging in physical fitness, relaxation, or quiet time. Learning how to diaphragmatically breathe is also a helpful stress management skill. Regular practice of deep belly breathing has been shown to reduce blood pressure. Diaphragmatic breathing includes breathing deeply and slowly into the abdomen with the use of appropriate muscles. So what you can do is imagine that as you're breathing in, the air travels down the lungs, past the diaphragm and into the belly. And the belly expands, almost like you're filling up a balloon. So as you breathe in, the belly expands with air. And as you breathe out, you feel the belly start to contract, and the air leaves up out of the belly, up out of the lungs, out of the mouth. So as you breathe in, the belly expands like the balloon. And as you breathe out, the belly contracts. And that's a great thing to practice on a daily basis. Clinical depression is another risk factor for heart disease. The kind of serious depression that affects your health can develop when the normal sadness and grief mentioned before becomes more intense and prolonged. In combination with the physical blow to your system, it can produce the following symptoms: pervasive fatigue, sleep disturbance, difficulty falling asleep or early morning waking, problems with concentration, memory, decisions, loss of ability to enjoy life and simple pleasures, long-lasting withdrawal from friends and family. And especially the following symptoms are signs of more serious depression: deep sadness, despair, hopelessness, thoughts of wanting to die, thoughts of suicide, feelings of worthlessness, excessive guilt. If you are worried that you may be experiencing depression, let your doctors and cardiac rehab team staff know right away. They can help. Much research has demonstrated that pervasive hostility is a critical risk factor for your heart. Having a lot of anger and a generally negative, cynical attitude towards people have been linked strongly to heart disease and mortality. Unhealthy hostility may surface in problems such as frequent arguments, road rage, temper outbursts, or general intense impatience. Finding ways to manage and safely express anger is critical to recovery from heart disease. If you think you are having problems with managing your anger, talk to your physician or cardiac team. They can provide you with appropriate resources. Research has demonstrated that those who have a strong social support network have healthier outcomes and quicker recovery time. Heart patients with a close emotional support network tend to live longer and recover more quickly than those who are more socially isolated. This is really an important time in your life to invest time and energy into building closer relationships with family and friends. Open up about your fears, concerns, and frustrations with people who care, and build and strengthen relationships. These relationships actually promote the healing of your heart. If you suspect that any of the issues mentioned before are a difficulty for you, get the problem evaluated further. You can talk it over with your cardiologist or family doctor. You can consult with a mental health professional, or if enrolled in a cardiac rehabilitation program, talk it over with staff. These professionals will not only help you assess your risk levels, but will also provide you with resources and strategies to make reducing this risk factor an integral part of your rehabilitation program.